Okay, I'm Specialist Brown, first name Ayana, and I'm here to inform you about what the M50 Pro Mask is. It indicates when we to ever get attacked by a nerve agent. This is one of the few things that we can use to help prevent getting nerve agent in your eyes, in your mouth, and all over your face, which it does. It's really, really bad for your skin. Like, it can burn pretty bad. This is efficient to any CBRN soldier's mission. CBRN meaning chemical, radiological, biological, nuclear specialist. What it prevents, how to operate, and how to put it on properly. This prevents it exactly prevents biohazards, chemical hazards, radiological particles from getting in the airways and the face. Okay, I know this. Okay. This is the mask. All of these are the filters. 2 filters come with each mask. They don't come on the mask. They actually come separate, and you order them completely separate. This is your voice meter. With your voice meter, you can actually attach a mic to it, so because it's really hard to hear. Well, it's really hard for anybody to hear you when you're speaking. This also comes with a tube that hooks up to canteens, so you can drink. And it comes with also the harnesses. It comes with 1 strap at the top, 2 straps at the top, 2 on the sides, and 2 on the very bottom. The mask also comes with an eyeglass that is supposed to go over the front of the gas mask. We try not to use these. It's really hard to get, and they're very easily broken. So a lot of times we leave these in the bag, unless it's like unless they need to be put on for certain events, like certain things that goes on. This is a waterproof bag and your canteen cap. This is used for your canteens. If your canteen cap, like if your cap isn't correct, like you have a messed up cap, this is the right kind of cap to put in your canteen because it has a hole at the top that pops off. So you can hook it up to your gas mask. It also comes with your operator's card. Your operator's card will tell you pretty much everything that you need to know in reference to the gas mask, and how to install certain stuff, how to put it on. This is like, yeah, your operator's card. And all the smaller pieces go in this bag. Can I get somebody that wears a size medium so I can show them how to put it on? Okay. The M50 mask is self-sealing. If you take off both canisters, you will not be able to breathe. The purpose of that is because the old mask only had 1 canister, so when it was time to change out, it was more like you had to hold your breath until you could put another canister on, which isn't too good. With this one, when it's time to change your filters, you can just take one off at a time and change them as need be. Whenever putting a gas mask on somebody, you loosen up all the straps at the top and on the side. The bottom straps will be adjusted by the person wearing them because it adjusts to your right here in your the bottom part of your chin. That's just to see how comfortable it is to them. But the top straps actually have to be adjusted to the top part and the temples of your head. If they're not adjusted correctly, there's the possibility you're not gonna have a good seal. So you put it on. You pull over the top part of your head. You start with the top. You pull, you ask them if it's tight enough. Is it tight? You ask them if it's tight enough. Is it tight? Okay. These straps you don't touch once they're sized to your head. If you do not know exactly how if you haven't been completely familiarized with a gas mask like a 74 Delta soldier or somebody that's been trained, if you loosen these straps, you wouldn't know how to put them back. So that means your seal at the top has been broken. These straps on the side have a lock. So you pull, is it good? Mm-hmm. And you push and you lock it in place. That is also a real easy way to get gas or any kind of other particles that shouldn't be in your face. Is that good? Mm-hmm. So the bottom ones, he'll adjust himself. He'll pull them as tight as he feels like he needs to. Okay, when sealing, when making sure you have a proper seal, you do have to don and doff your gas mask. So when sealing your mask, you put your hands over all the holes on both sides. You breathe in. Try again. You shouldn't hear any air. The mask will suck to your face. Breathe out, and he'll feel a pop. You won't hear it, but he'll feel it. That pop means your mask is completely sealed. If it does not suck to your face, if you keep hearing air, try using somebody else's hands who are a whole lot bigger. Me, I don't have that problem. Females who are very tiny, a lot of times have the issue of covering all the holes on each side of the mask. You would find another person to put their hands over their mask. To put their hands over the holes to make sure your mask has been sealed correctly. If anytime we have a chemical attack, you do not put somebody else's mask on first. You put your mask on first, and you assist others. Meaning, you can't help somebody put a mask on if you can't breathe. Okay. It's actually really easy. I've done this more than one time. And thank you for listening, you guys. I really appreciate it. And that's your class day.